Good day to everyone. I'm Dr. Farhana from Department of Psychiatry. I'm a senior resident from Sree Balaji Medical College and Hospital, Krompet, Chennai. So today's topic is going to be introduction on psychiatry. So as every specialty has a particular system or an organ it deals with, psychiatry deals with the mind. So mind is an integrated capacity of the brain. What do we understand by this integrated capacity? So the brain is made up of different parts and each part has numerous functions. So some of these functions put together forms the mind. Thereby, mind does not have an anatomical structure. So what are the functions of the mind? They are thinking, decision making, memory, intelligence, emotion, control over one's behavior and talk, awareness of their surroundings, and how we respond and react to certain situations. Though we say that mind is only made up of functions, certain reversible and irreversible changes occur in the neurons of various parts of the brain due to certain stimuli and information. For example, let's take a child. Children are experiential beings, meaning they learn from experience. A mother will tell a child to not go near a hot object, a stove, or a hot plate. The child may not understand why the first time. He will go and touch the hot plate, and due to the heat, he will experience pain, and this will induce a fear in the child, and he may start crying. So, this is a learning process where the stimuli of the heat, the pain, and fear it causes is embedded in the neurons of the brain. So, next time the child sees a hot plate, he will think about his previous experience. The information is retrieved from the brain and he will not go near a hot plate or a hot object again. Hence, all of these activities are directly or indirectly controlled by the neuronal circuits in the brain. Now that we have a basic understanding of what is mind, let's have a look at what is mental health. So, the World Health Organization conceptualizes mental health as a state of well being in which the individual realizes his or her own abilities, can cope with the normal stress of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Mental health encompasses emotional, psychological, and social well being. It influences cognition, perception, and behavior. So, what is perception? Perception is making sense of sensations, sensations like sight, smell, taste, hearing, and touch. From a simple touch, we can make out if it is a good touch or a bad touch, an affectionate touch or a touch which is hostile. All of this is processed in the brain. And cognition refers to reception, processing, and storage of the information. Mental health also determines how an individual handles stress, interpersonal relationships, and decision making. The characteristics of a mentally healthy person will be discussed later. Now, what is a mental disorder? Mental disorder is otherwise called as mental illness or psychiatric illness. It is an illness with psychological or behavioral symptoms and or impairment in functioning due to genetic, physical, biological, social or psychological reasons. So, what are the characteristics of mental illness? Abnormal changes in functions of the mind. That is, one's thinking, feeling, memory, perception, and judgment are disturbed. This results in a change in talk and behavior, which appears to be different from his usual personality. These changes can cause distress and suffering to the individual and people around him. Consequentially, this leads to disturbance in their day to day activities, relationship with important other people, and social and occupational or professional dysfunction. At this stage, the person needs to seek help from a mental health professional. With this understanding, let's move on to what is psychiatry. Psychiatry is defined as the medical specialty devoted to the diagnosis, prevention, and treatment of mental disorders. So, who is a psychiatrist? A psychiatrist is a doctor who specializes in mental health, mental disorders, including substance use disorders. So, there's a common misunderstanding in the public that psychiatrists and psychologists are the same and the terms are used interchangeably, but they are both different fields even though they deal with mental health. Psychiatrists, psychologists, psychotherapists, counselors, social workers are all mental health professionals, but they don't approach and treat mental health in the same way. So, what exactly is the difference? A psychiatrist is a doctor who has completed his MBBS course, has undergone training in the treatment of physical illnesses, and further specializes in mental health, diagnosis, and treatment of mental disorders by completing a post graduation degree, either MD or DPM, in psychiatry. As a doctor, he is qualified to prescribe medications, request for lab investigations or brain scans, and he is trained to interpret them. He is also trained in psychotherapy, whereas a psychologist studies the mind. He gets a degree in psychology, either BA or BSc in psychology, MSc in psychology, and may get a PhD. As they are not doctors, they cannot prescribe medications or order for lab investigations. They are trained in talk therapies, psychological testing, diagnosis, counseling, and psychotherapy. The field of psychology and psychiatry are both essential in researching and developing treatment for improving mental and emotional health. Differences aside, psychologists and psychiatrists share a common goal, that is, helping people feel better. Let's have a look at the epidemiology. Mental illness occurs across all age groups, from childhood to adolescent to adult to old age, affecting men and women alike. In 2017, mental disorders were the second leading cause in terms of years lived with disability worldwide. The Global Burden of Disease study said that globally, slightly more than 1 in 10 people are suffering from mental illness. India has one of the highest prevalences of mental illness globally. 1 in 7 Indians were affected by mental disorders. As per WHO, 56 million Indians suffer from depression and another 38 million Indians suffer from anxiety disorders. The National Mental Health Survey 2016 found that close to 14% of India's population required active mental health interventions. Let's have a look at the characteristics of a mentally healthy person. A mentally healthy person is aware of his strengths and weaknesses and works on improving himself. He has a healthy self esteem, positive self concept, and a good, healthy self confidence. Practical and realistic about his goals, he plans accordingly and is persistent in achieving them. He is able to bounce back from adversity and failures. He is hopeful about opportunities and has a healthy attitude towards life's challenges and difficulties. He is responsible for his personal behavior. He is not overwhelmed by his emotions. He respects his own needs and needs of others. He has the ability to manage stress effectively and make adjustments. He has the ability to work productively. He maintains a good support network with his family, friends, and mentors, and he seeks help or advice when needed. How does a mental illness or a psychiatric illness develop? Basically, it is multifactorial. That is, there could be many reasons. You cannot pinpoint to one cause and say that is the reason for the mental illness. There are multiple factors playing a role in development of psychiatric illness. So for the ease of understanding, we have divided it as psychological factors, biological factors, and social factors. So let's have a look at the biological factors. A person may develop psychiatric illness if he has the genetic vulnerability, meaning that any of the family members are suffering from a mental illness. An imbalance in the neurochemicals or the neurotransmitters in the brain can cause a mental illness. Any physical disease, comorbidities, or metabolic disorders can also lead to mental illness. For example, diabetes, thyroid, and PCOS are well known to cause comorbid depression. Any stressful life event can also disturb the chemical balance in the body, leading to the development of a mental illness. Apart from that, any long term medications taken for physical illnesses can also lead to a disturbance in the mental health. Our dietary habits, our lifestyle, and our sleep pattern and our exercise patterns also have a huge impact on our mental health. Moving on to the psychological factors, a person's self esteem, attitudes, and beliefs in life, his coping skills, perception, temperament and personality, and social skills all play an important role in maintaining the mental health. So does his response to reward and punishment and his ability to control his emotions. When we look at the social and environmental factors, we have to see the socio-economic status, the financial status, if there's any presence of debts, family circumstances, culture, his peer group, that is the people he moves along with, his school life, his work life, if he's employed or unemployed, and his work life balance. All of these again play a huge role in development of a psychiatric illness. Now, any one of these factors, if they are disturbed, might not necessarily lead to psychiatric illness. The more the number of factors are affected, the more the chances of them developing a psychiatric illness. Now, when we take a certain circumstances, say for example, loss of a job or loss of a loved one, not everybody reacts the same way to these circumstances. A few people may be able to cope well and come out of it, whereas the others may go on to have some mental health issues. So, this is where the role of resilience comes into play. So, resilience is based on a person's ability to jump back from an adversity. And he has, again, good self confidence and self esteem. And most importantly, he has a good social and support network. That is, he derives his support from family, friends, and mentors. And he, again, works on himself, his strengths and weaknesses. So, this again, we see that resilience is largely based on the mental health of a person. So, if a person's mental health, he's not maintaining his mental health, then they might fall into mental illness. Let's move on to the classification of psychiatric disorders. So, it is loosely divided as psychosis and neurosis. In psychosis, the person loses touch with reality. That is, he lives in his own fantasy or an imaginary world. Whereas in neurosis, there's no loss of touch with reality. In psychosis, the personality changes. while compared to their previous personality. After the development of the mental illness, their personality is different. Whereas in neurosis, there's no personality change. In psychosis, they are not aware of the presence of illness, whereas in neurosis, they are aware of the presence of illness. They can feel that something is different about them, and they can also realize that it is due to any stressful life event that they're facing. In psychosis, the language, communication, and thought process is affected, whereas in neurosis, this is intact. In psychosis, there is more influence of genetic factors, whereas in neurosis, there is less influence of genetic factors. This does not mean that there will be an absence of genetic factors, just that in psychosis, the presence of genetic factors is a very important predisposing factor. In psychosis, there is a lesser chance of development of the illness due to stressful life events, meaning they might develop the illness even in the absence of a stressor. Whereas in neurosis, there is more chance of development due to stressful life events. Psychosis is difficult to treat. They might require long term treatment, whereas neurosis is comparatively less difficult to treat. They might require only short term medication and might get better with psychotherapy. Psychiatric disorders are classified and their diagnostic criteria are given clearly in International Classification of Diseases 10th revision, that is the ICD-10. This is followed worldwide. While in America, the Diagnostic and Statistical Manual of Mental Disorders 5th edition, that is DSM-5-TR, is followed. So this brings us to the conclusion of the lecture today. Let's have a look at a brief summary of the lecture. So, mind is the integrated capacity of the brain. Different parts of the brain has numerous functions, and some of these functions put together forms the mind. We also had a look at what is mental health and what is mental disorder. So mental health is a state of well-being which encompasses the emotional, social and psychological well-being. We also know that mental disorder is a dysfunction in the functions of the mind which causes distress to the individual and others around him and can lead to social and occupational dysfunction. Psychiatry is a medical specialty that deals with the diagnosis, treatment and prevention of mental disorders. We also saw that development of mental disorders is multifactorial via the biopsychosocial model. And we also saw the classification of psychiatric disorders. Individual disorders will be discussed in future lecture sessions. Thank you.